Please note that the views expressed are those of the host or guest and are not necessarily shared by Vertex. All participants have been compensated by Vertex. This podcast is only intended for U.S. audiences and for educational purposes. It is not intended to replace discussions with your healthcare provider.
Hi, everyone. Welcome back to the Walking with Warriors podcast, brought to you by Vertex Pharmaceuticals Incorporated, where we take a look at the sickle cell disease caregiver experience through our eyes. I'm Patrice.
I'm Elle. Today, we're diving into how SCD changes as warriors get older and the types of conversations caregivers should be having with their healthcare providers. Remember, everyone's experience with sickle cell disease, or SCD, is different. So it's important to talk to a doctor before making any changes to your routine.
Joining the conversation today is Dr. Charles Azar. Dr. Azar is an expert in sickle cell disease and a hematologist at the Massachusetts General Hospital and Harvard Medical School, and the medical director of the Comprehensive Sickle Cell Disease Treatment Center. Welcome to the podcast, Dr. Azar.
I am so grateful to be with you guys, and thank you so much for inviting me to be on.
Dr. Azar, we are so thrilled that we're able to talk to you. You are somebody who just is always ready to talk about sickle cell disease, and we appreciate you taking time to have this conversation with us.
Oh, we are so excited. You are just a superstar in this community. We appreciate all that you do. And for you to take the time out to be with us today just means the world. So again, thank you, as Elle has said. So let's get into this long-term damage. We know that, there's so much that can happen with anyone living with sickle cell disease. But are there any, is there new information that's on the horizon that we should know about in terms of long-term damage?
There are a few things that we're beginning to learn about. We, as our patients are now living to adulthood, we are beginning to understand more about the way the disease can affect the heart. We're beginning to understand the importance of cardiovascular health and exercise, things that patients have otherwise long been able to think about, but in sickle cell disease, we haven't really thought about because we haven't had patients living long enough to be able to see that. We're getting new information about what we should be doing to screen for osteoporosis and bone damage and bone health in patients with sickle cell disease. And we're learning more and more about the long-term complications to the kidneys and to the eyes from living with the disease as well.
So with all of the long-term damage that could possibly happen, you've mentioned quite a few things today. What do you think is the most important we should be looking at?
My gosh, that's that's an important question because it's really hard to pick and choose. I think that the complication list of sickle cell disease is so poorly understood and so poorly talked about that most providers don't even know to think about these complications. I think when most of our warriors come into the hospital, the emergency room or the internal medicine team who ends up caring for them think about pain. And pain is important, and pain is the single most important reason why our warriors seek care. But oftentimes, these vaso-occlusive crises get written off as just being pain. And unfortunately, many providers don't think about the fact that on hospital day 2, you could develop acute chest syndrome. A patient who develops any neurologic symptoms, we should consider the risk of stroke.
I would like to ask you, are there specific areas of damage that you have seen, or specific cases that you've seen perhaps again and again that maybe were not on the radar Now they are, and you really make it a point to talk about it with your patients and their families.
So osteonecrosis is a great example of this. We now are at the point where we can intervene on osteonecrosis far earlier. But here's the caveat. You have to be able to catch osteonecrosis early in order for this to be an option.
My
So
goodness.
because there are no good screening guidelines around osteonecrosis, I help educate my warriors about what to see, what to think about as they're managing their pain every day. I identify some clues that might allow them to then tip me off that would lead us to get early imaging so that we can catch osteonecrosis as early as we can.
So I think you're reading our minds, because I wanted to ask you about that. Like, what are some of the signs we can look for, and not just for the osteonecrosis, but for other things as well, for those other long-term issues that we see? What are some of the telltale signs?
So when it comes to osteonecrosis, what I tell my patients to be on the lookout for are pains in a particular joint or crises that always start in the same joint. So their knee is always the place where it starts, or the hip is always the place where it starts. Or that at the tail end of a crisis, the rest of the pain in their arms and legs and chest is gone, but that pain in that right hip just keeps hanging on for several days afterwards. Then when it comes to kidney disease, I tell warriors to be on the lookout for changes in their urine. Changes in vision at night can be signs that sickle cell disease is beginning to affect your vision and leading to retinopathy. And any focal neurologic symptoms, weakness in the arms or legs, changes in your ability to concentrate, to learn, to understand language, to vocalize, all could be signs of an early or burgeoning stroke or silent infarcts coming from sickle cell disease.
A lot of caregivers haven't necessarily had an opportunity to know about all the complications.
Sure.
I know for many of us, we go to different conferences, go to different events, and get a lot of education. But the person who's really dealing with this day to day, often they're not equipped with those same experiences where they know to ask about different complications. So how should caregivers think about approaching preventive long-term damage? Are there things that can be prevented?
So yes, prevention is absolutely the name of the game, because unfortunately, given our understanding of the disease, we know that there's very limited treatment options once these complications actually occur. So I teach my residents, my medical students, and my fellows that if you've met one patient with sickle cell disease, you have met one patient with sickle cell disease. It is an individual experience from warrior to warrior.
Are there any questions that they need to be asking their provider? So I'm thinking, during pediatric times, there may be some questions that are more relevant. Then when they become middle schoolers, I'm thinking about like adolescence and puberty, things start to change.
Right.
Are there questions they should be asking? And then as they become young adults, maybe they're curious about, different things. They're meeting other people, all kinds of things. Are there some questions that they should bring up at all the different stages? Maybe, one or two questions in each stage.
Sure. So, the question about, when warriors and their caregivers should be having these conversations with their providers is really important, because I think many of my pediatric colleagues who are amazing providers don't tend to think a lot about some of these complications because they really don't manifest until adulthood. But I encourage my pediatric colleagues to try to bring these up early on. And I get it. My pediatric colleagues really want young warriors to be living their best lives, to be in school, to be playing with their friends, to be trying to socialize normally, to have as normal a life as they possibly can. But at the same time, I sometimes find that as an adult provider, when I have a young warrior who's coming to me transitioning from pediatric to adult care, and they manifest the first severe end organ damage from their disease, it catches them off guard. They're very used to, at that point, knowing what pain feels like and knowing what a pain crisis is like. But they are not used to understanding what osteonecrosis feels like or what retinopathy feels like. And when we've had those first conversations with warriors, when they've encountered that first complication, I've had many warriors say to me, "Oh my God, I didn't realize that that was even something that could happen to me."
Yeah. Yeah.
These are things that as caregivers, we hear people say, but we don't necessarily know how to check up on it. And so how can caregivers and their warriors partner with their healthcare team? Like, what would an ideal partnership look like?
So an ideal partnership in my mind is one where the burden is not solely placed on the warrior or their family member, that you've got someone on the other side of the white coat who is actually aware of a lot of these complications and is thinking about them at all times. As a sickle cell doctor, I know that my medicine colleagues who are caring for my warriors when they're admitted to the hospital are not aware or not always thinking about the complications of the disease, the rare complications, the unique complications, the severe complications. That's my job. I have to always be thinking about those things. And so whenever I am looking at my warriors in the hospital and I'm picking up on changes in their labs or changes on their imaging or changes in their symptoms, I'm contextualizing that in the framework of sickle cell disease overall. So you need to have someone who is aware of those complications and who's constantly learning and re-educating themselves about sickle cell disease. But then I think you also have to have a trusting relationship, because you need to be able to bring those concerns to your providers and not be afraid that they're going to write them off or they're going to poo-poo them or that they're going to dismiss them. You're going to bring up a concern, and it sometimes may be a conversation where I'm just saying to you, "That's really important. I'm glad you brought it up, but it's nothing we need to worry about right now. Let's put a pin on it and just keep watching it." But when you do bring up a concern to me that is actually worrisome, I need to be able to jump on it.
So, Dr. Azar, as you know, the sickle cell patient, more often than not, does not live alone, does not care for themselves fully by themselves. There are caregivers. And we know that it is important for the caregiver to take care of themselves so that they can offer the care to the sickle cell person living with sickle cell. Is there any advice that you have for caregivers around taking care of themselves?
I'm so glad you brought that up, because one of the things that we try to do, our social worker in particular, is to really try to empower our sickle cell caregivers and warriors' family members to give themselves grace, because I think so many times the parents of my warriors especially will blame themselves when something goes wrong.
Yes.
You have had to, as a parent of someone living with sickle cell disease, basically be a shark watching everything that their providers do, making sure they're not mistreated when they come to the emergency department, assuring you're not missing a symptom at home, making sure you're not delayed in getting to the ER. That's exhausting.
Yes.
And I don't have to tell you guys that. It is exhausting. And I always remind parents, first, I always think it's important for I, as their provider, to acknowledge the important role that warrior's caregiver has played in even getting them to be sitting in front of me,
Nice.
right? Most of our warriors would not be alive today if it was not for someone in their life being able to help them manage their symptoms and their disease growing up. And I'm so grateful. That many of my warriors have someone like that in their life who has really been there as a source of support for them. But I always tell them too, you cannot pour from an empty cup, right? It is what what we hear about in the airplane all the time, right? You got to put your own mask on first before you put it on to the person next to you. I encourage my caregivers, my warriors' caregivers, and their families to do something good for themselves. And that might mean if I have a warrior in the hospital, if I have a warrior who's admitted for a week or two, and I see that caregiver sitting at their bedside every damn day, like any good caregiver does,
Yes.
it is my job to tell them, listen, our team is here. We got them.
Yeah.
Let us take care of them so you can go home and get a good meal, get a shower, run an errand, take care of the dog, do something away from this hospital. Because every day that you sit here and you're fatigued and you're worn out is a day you're not going to be able to care for them when I discharge them.
That's good right there.
I like that you use the word shark because you're right. I feel like we always feel like there's a heightened attack. We're always in this fight or flight mode. And I feel like it is a weight. And I would say that, it is a weight that we welcome because we love our warriors. But I think for some of us caregivers, it's hard. Some of us, we're able to cope and manage it.
Yeah.
But for others, it's not so easy.
Yeah. And not only that, Elle, I think there are times when we don't even realize what it's doing, or we don't realize the weight of it. I had a break one time where my warrior was not having crisis back to back. And he was sleeping through the night, and he was not waking up in horrible pain or not, none of those things. And it happened for several months. And it took about, probably 90 days before I realized I was actually sleeping. And that I had not been sleeping because I was not fully resting. I was sleeping with one ear open.
That's right.
Because I'm always listening out for his room, for his call, for his cry, or the knock at the door, in the middle of the night. I was listening for that. So I wasn't fully resting. And this is the longest he's had. I think it was about 10 months where he didn't go in for an admission.
Guys, this is why I feel, this is why having a team that knows how to care for your warrior is so important.
Yes.
Because if my warriors' families trust me and my team, they can feel empowered to say, okay, I can leave them alone.
Absolutely.
You don't have to be swimming around them to try to keep them safe.
Yeah.
Thank you, Dr. Azar. I feel at ease.
Yeah.
We don't have to stay at home. We can go places. And you know what? It sounds so simple, but I think there are some of us who really need that permission, that understanding, that, we're right there with them.
Yeah.
We can live our lives. We can proceed.
Yeah.
Just breathing. We can live.
Yeah.
And to those who are listening, just say it with me. We can live.
I love it. Not only can they get on that plane, but we can also get on that plane without them.
Mm-hmm.
So that's another level.
Hallelujah.
That's another level. Yes. Right there, So Dr. Azar, what is the one thing you wish that all caregivers knew about sickle cell?
I would want caregivers to know that if they get the right kind of care and they can be plugged into a team that can carry a lot of the worry weight for them, they don't have to spend their days thinking about or worrying about their disease.
I like the concept of taking away that worry.
Yeah.
Because I think, for us, I think that's one of the common threads of this experience is in the back of our mind, we as caregivers constantly worry. And so the notion that could subside to me is amazing.
And I love that. And I was thinking, wow, that would be beautiful for caregivers to not have that worry as well. Love that.
Thank you for your time, Dr. Azar. I just feel so full. I feel inspired. I'm ready to go learn more, to talk to other caregivers. I just feel energized. What about you, Patrice?
Oh, absolutely. But I knew I would after this conversation. I knew that Dr. Azar would be the one to bring it. So our thanks it's, I don't know, thanks a million or plus. So thank you so, so much. You are inspiring, as you said, and you really have fueled my urge to do more, to learn more, and to just be a great caregiver to myself and to my warrior.
You've shared so much, and we're taking in this information. We definitely want to have notes. I feel like I needed to be writing down so many different lessons.
Yeah.
So I am grateful to you all for your ongoing wisdom in allowing providers like me to be able to do a better job of taking care of your warriors every single day.
Thank you so much for spending time with us. If you like this episode and want us to keep making more, please make sure to subscribe so you never miss an episode. You can listen or watch the Walking with Warriors podcast on Spotify, Apple Podcasts, YouTube, and walkingwithwarriors.com.
Please join us next time where we'll be talking about how we advocate for our warriors in the healthcare system. In the meantime, you can always visit the website for resources like a guide with questions to help you and your warrior talk about the long-term impact of SCD with your healthcare provider. See you next time.